Welcome to Thrive with Pride from Age Options, an online space for LGBT older adults and those who care for them. This is a recording of a live event held on Zoom. Matthew Vale of Rush University joined us to talk about the importance of affirming care. Matthew is the manager of social work and patient navigation for Affirm, Rush's clinic for gender, sexuality, and reproductive health, which, as you will hear shortly, coordinates care across Rush's system to provide affirming care for all. Please excuse the jump in the middle of this video. We edited out some technical
Thanks so much
difficulties.
for having me,
After you
everybody.
watch, please fill out a very
So it looks
short
like my title
survey to help us
disappeared from this
improve our programming. It's anonymous
first
and
slide
should
here,
take you
but as
less
I
than
said, my
5
name is
minutes.
Matt Vale, and
The link to the
I'm the
survey
social work
is in the video
manager for
description.
Affirm, which is the Rush Center for Gender, Sexuality, and Reproductive Health. And this is a topic that's near and dear to my heart. I teach aging and mental health at University of Chicago's School of Social Work, teaching new social workers how to do therapy and provide mental health services to older adults. And so, yeah, this is a topic near and dear to my heart. And so I just want to talk briefly about some of the ways in which healthcare in general has really failed older LGBTQ adults, and then talk a bit about what Rush's new center is doing to address some of those disparities. A question that I often get asked is who are we talking about? How many older LGBTQ adults are out there? And the truth is we don't really know, because we've done such a bad job of asking the right questions, of asking about people's sexual orientation and gender identity, right? Sometimes on a governmental level, but also on a healthcare level. We don't ask folks these questions when they come into clinics. And so a survey from 2009 estimated that there's somewhere between 1.4 and 3.8 million Americans over 65 who are LGBT. So that's a huge range, right? Which just underscores what a bad job we've been doing about collecting this information. And I'll talk later again about what Rush is doing to try to address that. It's so important for folks to understand, for providers to understand the history that older LGBTQ adults are bringing into the clinic with them. And it's not just in terms of physical well-being, but also mental well-being. Older LGBTQ adults bring a lot of trauma with them into the clinic. These are a couple of surveys starting from 1979 going all the way to 2014 that show that LGBTQ folks have experienced a lot of discrimination, physical violence, and verbal abuse. And you can see that those numbers are actually largely unchanged between these three surveys from 1979, 2003, and 2014. And so, as we're educating our providers at Rush, this is something that I really tried to drive home, is that folks have experienced a lot of discrimination, violence, and harassment, and that they bring that with them into the clinical space. We know that in general, that older LGBTQ adults tend to be more socially isolated. Chicago specifically, 62% live alone, less likely to be partnered. There might be fewer connections to biological family. We've also always struggled with a lack of an intergenerational connection. There are a couple of reasons for that, which I'd love to discuss later if we have time. Obviously, it's not just a sob story. There's also a lot of resiliency among older LGBTQ adults. And so while we might talk about fewer biological family connections, we also know that chosen family is equally important, and that this actually has a lot of protective factors for older LGBTQ adults' overall well-being, including physical health. We also know that there are fewer legal protections. Luckily, things have changed quite a bit in the last few years around spousal rights and benefits. But we also know that it's still legal to discriminate against LGBTQ adults in more than half the states still in terms of employment. There's a lot of, this slide says perception of discrimination in healthcare, and in some ways that's a misnomer because it's the discrimination is real. It's not that older LGBTQ adults are unduly afraid of accessing health services, but this really gets to the kind of level of confidence that people feel about getting proper care when they go and see their doctor. And so this 2006 survey, almost 20% had little or no confidence that providers were going to treat them with dignity and respect as LGBTQ elders. We also see that a lot of folks are not disclosing their sexual orientation or gender identity to their healthcare provider because they're afraid of negative reactions. And that this ultimately means that a lot of people avoid routine healthcare because they are afraid of being discriminated against by their providers. Let's see here. Right, so that anxiety, that fear of discrimination in healthcare means that folks aren't going to the doctor as much as they should. And that means that some medical conditions or chronic illnesses that might be common to older adults tend to be diagnosed later because folks are avoiding care. And that makes providing care more complicated because the conditions might be more advanced by the time the older adult gets to the doctor. Overall, when we're talking about older LGBTQ adults, we see higher rates of a lot of chronic illnesses, including physical and mental health conditions, depression, diabetes, high blood pressure, overall disability and self-reported poor health, and then also substance use, including alcohol abuse and tobacco use. Some of the risk factors for these for these conditions are lifetime victimization, so that discrimination, violence, and harassment that we talked about earlier, internalized stigma, and how long you might have been concealing your sexual identity. And then protective factors, again, social support and social network size. So getting back to that concept of chosen family. When you think about going to your doctor, what does an affirming provider look like? How do you know that you're with an affirming provider? And I think it's important for consumers, for patients, to have expectations around what their doctors should be asking, what kinds of questions. And these are some examples that I think are important. What I didn't include was, what are your pronouns, right? Which everyone introduced themselves with their pronouns today, which was really great. Are you in a relationship, and with whom? Are you sexually active with one partner or more? Who are your partners? What kinds of protection do you use? And any worries or problems relating to sex. And we know in general that providers are historically reluctant to ask our older LGBTQ patients about their sex lives. And there are higher rates of STIs among this population in general. And so it's really, really important that our providers are talking to us about our sexual health. I'm going to switch over here to another slide deck real quick, if you bear with me. So we can talk a little bit about what Rush is doing to ensure that folks get affirming care. So again, I'm representing Affirm, the Rush Center for Gender, Sexuality, and Reproductive Health, and we launched in January of 2020. It was January 2020. So we're a relatively new program, although we've been doing this work kind of unofficially for a long time. We're an interprofessional, multi-departmental clinic that goes across all sectors of the Rush University System for Health, and that includes Rush Oak Park and Rush Copley out in Aurora. And our goal is really to serve as a clinical hub for folks who are looking for LGBTQ affirming and competent healthcare. And for all the reasons we just described, older LGBTQ adults have not been getting the care that they need and deserve. So you can see here that we have a lot of different focuses with Affirm. We want to be providing, especially folks who are suffering from chronic illness, you're often going to be you're going to have multiple different specialties on your care team, right? So it's really important that that entire care team is affirming and competent. And so in order to accomplish that, we don't have a centralized clinic where all of our providers live. not like a Howard Brown, for example. We have a care coordination hub, which I'll get into more in a minute, where we are serving as like a virtual center and connecting patients to providers across the Rush system and with our community partners. We're also really focused on education. This has been a huge part of what we've been trying to do, is because we don't have all of our providers under one roof. We have needed to go into all these different spaces and teach providers how to provide competent and affirming care to our patients. And then you'll see here at the bottom that patient navigation and care coordination are kind of the foundation of what we're trying to do. So we have our care coordination team here. You can see our patient care navigators, Morgana and Willie here. And essentially what happens when folks contact us, they might reach out by phone, they might get a referral from a provider. We have an online intake form. They get an outreach from our patient care navigator. And that navigator will do an assessment to see what that person's needs are, and then build out a custom care team, right? And so I know the font here on this slide is small, so I'll read some of these, but this is just one example of one of our trans patients, all the different services that we needed to connect them with. It was primary care, endocrinology for hormone management, surgical consultation, voice therapy, fertility preservation, and mental health. And again, this is not an exhaustive list, but just an example of all the different providers involved. And so our patient care navigators not only connect folks to affirming and competent providers within those specialties, but they make sure that all those different providers are talking to each other as well, which is really important, again, when we're talking about managing chronic conditions. Some of these numbers are a little outdated because we've just been growing so quickly, right? So we've now navigated about 370 patients. So we have about 370 active patients we're working with, who are connected to 18 different specialties across the Rush system. And we've now trained actually over 2,000 employees at Rush in providing LGBTQ inclusive care. You'll see some of the biggest reasons for referral. A majority of our patients are trans, although we serve everybody under the LGBTQ umbrella. But the biggest reasons that people are coming to us are for surgical consultations, mental health care, primary care, hormone replacement therapy, other specialty care. This is our larger Affirm team. Even though the foundation of our program is patient care navigation, we have representation from most of the important specialties that serve our patients, right? So including plastic surgery, OB-GYN, endocrinology, psychiatry, primary care. And then we have our representative from out at Oak Park, Dr. Lucy Fox, who's our other one of our primary care representatives in the Department of Family Medicine. So we're a small but mighty team, and again, we stretch across the entire Rush system, including the downtown campus and our two suburban hospitals as well. We have a sort of no wrong door policy in terms of how people can connect with us. We have an email address, we have a hotline. And we have our online intake form, which we check that daily and reach out within 2 business days. And then Epic referral, which just means when providers within the system can connect people to us when they send an order to us. So we are continuing to grow really rapidly. And really excited to be able to share this information with you all. And again, we're serving folks across the lifespan, but I feel that building out these competent and affirming care teams is especially important for our older LGBTQ adults who again have had a difficult time accessing appropriate healthcare. So yeah, I want to thank you all for giving me the time today to share about this new program, and would love to hear some questions from folks.
Thanks again to Matthew Vale for a great presentation, as well as his lively Q&A chat afterwards, which we did not record. Please check out the video description below for more information, including a link to Affirm's online intake. Please join us for our next monthly event on April 27th, when we'll be hearing from NAMI, the National Alliance on Mental Illness, about mental health during and after the coronavirus pandemic. Nikki Rashes of NAMI Metro Suburban will talk about how we can take care of ourselves and one another in an unprecedented time in our nation's history. Thanks again for watching, and please don't forget to fill out the quick survey below and join us in April.